Hello, everybody. It is Kathy Frey here from IMCO, from the International Integrated Maternity Healthcare Organisation. And welcome. People are just starting to sign into this week's webinar. And just a wave there from Julia, who is our speaker today. Say hello, Julia.
Hi, everyone. How are you?
Fantastic. And all right, so just getting into our little bits and bobs here. So everybody, as you're coming on in, if you could please just go into the chat and just let us know where you are in the world in your role. That would be really wonderful for us. And then also just a reminder, so the chat is down the bottom, and then also down the bottom is a little button that says Q&A. So if you've got any questions for Julia, do type them in, and we'll absolutely make sure we get through those questions before the end of this webinar. So just a little introduction, because of course our topic today is acupuncture for birth preparation and labour, which is something very close to my heart. So just a little overview. Julia is a mum of two, and she's an acupuncturist, and she's a Chinese herbal medicine practitioner. And Julia's main areas of interest is women's health, fertility, pregnancy, birth preparation, and postnatal care. And then prior to studying Chinese medicine, Julia worked as a medical scientist. So that's really cool, coming from that, that biomedical model through to the very holistic model. Love it. And Julia utilises her knowledge of both Western and Eastern science to develop a holistic treatment for everyone. And after surviving a car accident at the age of 19 is when she was drawn to Chinese medicine through her own experience. And Julia uses acupuncture and acupressure during both the birth of her two girls. And we are going to particularly talk, but we are going to cover, she's going to cover the topics of acupressure today, which of course is something that women can do for themselves as well during labour when they know how. Yeah, we're going to hand on over to Julia. So welcome.
Thank you, Kathy. Hi, everyone. I'm so excited to be here and talk about this topic, which is one of my passions. And yeah, I hope you really enjoy it and that you get a lot out of it. So I'm going to do it as a webinar topic. So I'm going to talk for about half an hour, and then I'd love to answer all your questions. So I really look forward to presenting today. So a little bit nervous, so bear with me.
Thank you for those that are putting their little chat in there. Yeah, so it's just great to see. We've got interesting little places people are coming from. It's fantastic. So, okay, that's just wonderful. So I'm going to hand you on over now.
Okay, so welcome everyone. So today we're going to be talking about birth preparation and acupuncture. I'm just going to run through, so from a traditional Chinese medicine point of view, why it's really important and how the ancient Chinese through to today actually look after their women in pregnancy and postnatally. And then I'm just going to talk about some research that's come out from Australia, done by Kate Levitz. And then we're going to go into a couple of points that we actually use in birth preparation using acupuncture and acupressure, running through the benefits and how acupuncture actually reinforces a woman's natural state of harmony. And then I'll just finish off talking about acupressure for natural pain relief in labour. So let's get started. Okay, so TCM is an ancient medical system.
Sorry, Julia.
Yeah.
I think you need to change your screen view a little bit.
Okay, what's going on?
We've got the picture of your slides, but also your notes.
Yep. Okay.
Oh, is that what you're wanting? Oh, I was thinking we had the slide full screen.
It's all right.
Oh, okay, all good. I'll be quiet.
All good?
All good.
Okay. So basically TCM is an ancient medical system. It's over 15,000 years old. The written records that we have is about 3,000 years old though. So in ancient China, it has a long history of actually promoting that women during pregnancy need to modify their diet, their lifestyle throughout pregnancy to help to maintain a healthy pregnancy, a healthy baby, and an efficient birth as well. So the advice from ancient China included regulating physical activity, changing their diet, making sure that they avoided spicy food, greasy food, overeating, so having too many big meals because that can put a lot of pressure on the digestive system, just eating small meals and maintaining a calm state of mind. So the reason why they actually focus on that is because we need the blood flow and the energy, which is known as qi, and the emotions to actually be flowing freely. So if anything like that gets stuck, it can actually affect labor and birth as well. So, and this is why we emphasize on harmoning a woman's body, promoting that smooth flow of energy, that smooth flow of blood, and calming the state of mind, because when they're all in harmony, this promotes labor and it promotes a more efficient labor so that they can have a natural birth. So pre-birth acupuncture. So original research was done back in 1974 in Germany, and they used a group of 70 women, and they were split into women who received acupuncture from 36 weeks, once a week for 4 treatments, compared to women that didn't have any acupuncture leading up to their birth and labor. So the original outcome of this was that there was a reduction in the mean time that women were in active labour. For those women who had acupuncture, their active stage of labour, the time that they were in labour was actually reduced from 8 hours and 2 minutes from the control group down to 6 hours and 36 minutes. So this is actually amazing that, you know, just using acupuncture to prepare for labour can actually decrease the time that you're in labour. And they used 8 points mainly, and this was just preparing the woman, so preparing the emotions and just focusing on balancing her energy and promoting that smooth flow of energy and blood in the body. So since then, there's been further research done from the original one back in Germany, and the most recent has been done by Kate Levitz, and she has a Cochrane review which came out. So this was actually done in New South Wales in Australia, and it is one of the first randomised trials done here in Australia. So for those of you that don't know, Australia actually has a really high incidence of C-section rates and medical intervention, a lot higher than the World Health Organization actually recommend. So her randomised trial, the women had to be pregnant with their first pregnancy and have no complications at all to be part of the trial. So they were then randomised into a control group and into the actual group that received complementary therapies. So these women actually attended an antenatal workshop, which was the she birth classes, in which they were actually given information about massage, birthing positions, optimal fetal positioning, and acupressure for natural pain relief in labour, as well as breathing techniques. And the study actually asked women prior to going into birth and labour how they were feeling and what their level of satisfaction of care was. So those that were in the control group just received standard care, so just normal midwifery or obstetric care. And those women in the actual trial received complementary medicine. So they attended the antenatal course. They had pre-birth acupuncture from 36 weeks once a week, and they also used the acupressure in labour. So they actually reported a higher satisfaction with their care prior to going in compared to the control group. And then the results from this study are absolutely amazing and just reinforce why acupuncture is such a great tool to prepare the body and the female for birth as well. So for those women in the trial group, who they received acupuncture once a week from 36 weeks, and there was an increased rate of natural and efficient labour. There was actually decreased rates of medical intervention, the decreased rate of using an epidural block, and decreased C-section rates as well compared to those women in the control group. And the active stage of labour, they actually had a mean time of 6 hours as well. So again, there's that reduction in the active stage of labour. So just proving that acupuncture is an amazing tool and that it works really, really well for birth preparation for all women. So, and the second study that she did actually was looking at the amount of money that intervention costs, and that using complementary therapies, preparing to help a woman prepare for labour and birth actually helps to reduce the cost of intervention in the hospital system. So what is pre-birth acupuncture? So we use acupuncture to help a woman to prepare herself mentally, physically, and emotionally for labour. And it's a series of treatments which generally takes place from 34 to 36 weeks, depending on what's going on. So what happens is we actually get the woman in for an initial consult. So this is very similar to how we would treat other issues as well. So we go through the initial consult and we'll go through her whole entire history. So we'll be asking about sleep, about diet, about her emotions. I focus on conception as well, because I do find that those women who have gone through the IVF process often have a lot more fear, a lot more stress, and a lot more anxiety around the labour just because of what they've actually been through. And it's really important that we address those emotions prior to going in to that birthing suite and labour. So we will go through her whole entire history, and we'll see if there's any medical conditions going on. We also use our tools from a Chinese medicine point of view. So we'll do the tongue and the pulse diagnosis, and then we'll come up with an individualized treatment for her. So this means that we will be doing the points for pre-birth acupuncture preparation, but we'll also be addressing her emotional state, and if she's got any medical conditions or if she's deficient in any way, we'll be focusing on reinforcing those so that she's in the best physical state that she can be going into labour. So acupuncture is an ideal way to assist with birth because we are focusing on balancing those emotions, on building their physical stamina up, and on harmonizing the body. Acupuncture is safe and effective to use throughout pregnancy, so we can use it as soon as they get pregnant, all the way through pregnancy, reinforcing the natural state of the body and just maintaining a healthy pregnancy as well. So when we're actually using acupuncture for birth preparation, we're focusing on four main things, and that is ripening the cervix, balancing the emotions, and preparing the pelvis for labour. So it's really beneficial from an acupuncture point of view on the body because it actually helps to reinforce those beneficial pregnancy hormones. So we ripen the cervix. We also focus on optimal fetal positioning as well. So pre-birth acupuncture can also be used to prepare a woman for a VBAC. Even if she's going in for a C-section, acupuncture is really, really important to build up that energy, that blood, and just help balance the emotional state, because even though women are having a C-section, there can be previous birth trauma behind the decision to have that C-section, or it could just be because they're breech and the woman really wanted a natural labour. So we're helping to help her understand her emotions and balance the emotions, and we also use it in preparation for a medical induction as well. So benefits of having acupuncture and using acupuncture for pre-birth preparation is that there's an overall increased well-being for the mother and for the baby as well. So midwives have reported that those women who are actually accessing acupuncture have a much more calmer state of mind. They're more prepared going in. They feel more empowered. They've prepared themselves, and they're in a much more positive state going into labour compared to women who haven't had acupuncture previously. Now, it's really beneficial because we are addressing those emotional issues which come up, which sometimes in busy hospitals with obstetricians and shared care, midwives and obstetricians don't necessarily have the time to sit down and unravel a whole lot of the woman's emotions. Whereas we can actually sit down, we can talk to them, we provide a safe and calming environment for them to chat about it. oops, I've just lost it. And also using acupuncture actually reinforces that going into labor, you are generally going to have a shorter labor anyway. And then we're focusing on that emotional balance, and we're also focusing on preparing the pelvis and the body for labor. So from 34 weeks, we're going to start relaxing the muscles and tendons. We're going to start using points that actually go up into the pelvis to help ripen the cervix and just help release any tension throughout the pelvis as well. We provide support and reassurance and a safe space for her to actually prepare for labor as well. So I just want to state that pre-birth acupuncture is not labor induction. There is a huge difference between the two. If a woman's coming in just for labor induction, I am focusing on actually ramping up contractions. So she will come in, but within that treatment, I will be actually stimulating the needles 3 or 4 times to try and get the hormones going, to try and get her having contractions and maintaining those, or going into labor actually as well. So there's no focus on that pre-birth, although one of the points that we use is the cervical ripening one. I will always, even when I'm doing labor induction, make sure that I'm trying to ripen that cervix, because there's no point bringing on contractions if the cervix isn't ripe and ready for dilation. So research has actually shown that just having a labor induction doesn't have any effect on the amount of time that you are in active labor for. It doesn't decrease the amount of time that you're in active labor for. And with the pre-birth acupuncture, I really focus on going through optimal fetal positioning. So I'll demonstrate what positions they should be in, how they should be sitting. I will go through acupressure with them. I demonstrate acupressure with them. I'll do it one-on-one with them and their partner. I'll book a time for them to come in for an hour, and I will go through each of the points to do acupressure for natural pain relief, and acupressure to change a posterior baby, to ripen the cervix. I go through that with their partner and with their birthing partner, and I get them to practice in front of me, and then they can actually go home, and every 3 days from 36 weeks they can use the acupressure at home to practice and to prepare her for the upcoming birth as well. So we also focus on breathing techniques while we're doing the birth preparation. So I'll focus on getting her to breathe so that we're calming those emotions. If they're doing calm birthing or hypnobirthing, I'll reinforce that breathing technique while I'm doing the needling so that she can get into practice for when she's actually in labor. We also talk about different ways to reduce stress. So going for walks, meditation, just having a rest, doing the deep breathing. We'll chat to them about the importance of diet and getting lots and lots of nutrients into their body prior to labor, and also just seeing how they are. So is there any fear surrounding going into labor? How's their stress levels? Because women prior to going on maternity leave actually have quite a lot of stress if they've got a handover, or they start worrying about what they have to do, and stop focusing on being pregnant, and they're too much up here and not so much in contact with their body. And many women just around that 36 weeks start feeling quite overwhelmed. So it's really, really important that we start focusing on balancing those emotions. So the emotional benefits, as we've just stated, women who actually receive acupuncture report, and midwives actually report, that they feel much calmer, that their anxiety is less, their stress is less, sometimes their frustration, irritation, and anger is actually reduced. They can feel an increase in energy, they feel lighter, they feel more joy, and that they're more self-assured. Sleep can actually improve as well. They find that they're not as exhausted. And they have a more overall sense of well-being as well, and sleep is quite often improved as well. So the main aim of the pre-birth acupuncture is, again, focusing on that harmonizing the body. So we're harmonizing the emotions, we're harmonizing the blood flow, we're harmonizing the energy flow, because when the body's in harmony, it promotes a more efficient labor. It goes into labor naturally. There's no blockages. So some women who are quite emotionally blocked, we can find that they have the stop-start contractions. They go into the contractions, but it's fear or their emotions which are actually blocking them from having the consistent contractions to actually go into the active stage of labour. So using acupuncture for birth preparation actually increases a higher chance of a vaginal birth and an efficient labour. And always, 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 for every woman, we are always addressing their emotions. So in clinical practice, there's two main forms of the acupuncture treatments for birth preparation. So one is just where we're focusing on birth preparation. So from our initial history, she doesn't have any medical conditions. She's pretty healthy. She's pretty fit. So again, we're focusing here on just balancing emotions. So she may be a little bit fearful, she may be a little bit stressed, she may just feel a little bit tired. We're going to focus on ripening the cervix, and if baby's in a breech or posterior position, we'll be focusing on optimal fetal positioning as well, and building up the energy and the blood. So depending on the practitioner as well, I'm also a massage therapist, so I will do gentle rocking and massage, particularly to the lower back and the buttocks, because I find that many women actually store their tension and their stress through there, and actually loosening this off actually helps to release those emotions as well, so that we can balance that and just reinforce that harmony within the body. So we're always going to be focusing on preparing the pelvis for labour. So we're going to focus on loosening off muscles and tendons, and just releasing any tension through that area, so that the woman has the best chance of having a natural labour. So I'm just going to run through some of the points that we use in pre-birth acupuncture now. So this point is the cervical ripening point. So some of you as midwives may know it as spleen 6 as well. It's called spleen 6 in acupuncture. So how we actually find this, I've got the slide here, the picture. So it's actually 4 fingers. So if you hold your fingers like that, you put your little finger just above the top of the inside ankle, and then this finger will actually land on the point. If you bring it just off the bone, you'll find a really tender point. This point is tender in all women, but particularly even more tender in pregnant women. And what you're going to do is, with acupuncture, I'll actually acupuncture the needle and they retain the needle for 20 minutes. If you're going to do acupressure, you're actually going to press in quite firmly and you'll hold it for 2 minutes, so that you go to the level of where the female is comfortable. You don't want her going, oh my God, that's really painful, stop. You just want to be putting the pressure on that is actually okay for her. And she will let you know if it's too much and then you need to back off. So this can actually be massaged from 36 weeks. So we start doing the acupressure and then actually massaging up along the meridian to just under the knee as well. So this meridian actually goes through into the pelvis and into the genitals. So this helps to ripen the cervix and to get it from being really long and narrow to start effacing, so that we can have that dilation starting to happen. So when you're doing the acupressure, you want to hold it for 1 to 2 minutes. And I teach all of my girls how to do this, and they will actually go home and be doing this every 3rd day in between seeing me for their regular acupuncture appointments once a week. So male position of the baby point. So this is actually on the end of the little toe, on the outside of the nail. So if you've got your nail here, it's literally right there. So make sure that all of your women have a ballpoint pen in their birth kit for the hospital, because we can actually activate this point in labour using a ballpoint pen. It's really easy to just use the pressure and the tip of the ballpoint pen as an acupressure tool. So we use this one for breech and for posterior babies. And this point is used in Chinese medicine to reinforce the optimal position of the baby. So making sure that the baby's in the anterior position. So acupressure, we can use little tiny tacks, although I find that if women are wearing shoes, it's often too much. So I just demonstrate to my girls how to use the tip of the ballpoint pen and apply the pressure to what feels comfortable for them. So again, with the acupressure, you're going to be holding it for 1 to 2 minutes. And that's all you need. So if baby is breech and posterior, I'll get them to do this point every day. So the point that we use to build up energy, to build up blood and stamina for labour, so this point is just underneath the outside leg, underneath the knee. So again, you're going to use your 4 fingers, as you can see in the picture, and then you just come off the outside of the bone and press in. So sometimes this point can feel a bit empty, or it can feel a bit tender. So the reason why we use this point is because it's an amazing point in acupuncture, and this point actually builds up energy. It builds up blood. It helps to increase white cells in the body, so it's building up the immune system. It focuses on digestion, so women are going to get the most that they can from the nutrients that they're eating, and it increases energy in the body. So it also has a really strong downward pulling motion. So if baby's posterior and you can't necessarily press in at the back when she's having contractions, you can actually use this point as an acupressure point instead of the lower back points. And this actually is a really, really good point because it does bring baby down into the pelvis as well. So the second form of treatment in clinical practice is if they do have medical conditions. So we're going to focus on preparing the woman for labour and balancing her emotions. So we'll be ripening the cervix, we'll be loosening muscles and tendons, we'll be building up her physical stamina, but we're also going to address whatever medical condition she has. So acupuncture is renowned for treating nausea, preeclampsia, anemia, lower back pain, pelvic pain, sciatica, and gestational diabetes. So in a general acupuncture treatment, even for women who aren't pregnant, acupuncture actually does decrease blood pressure and decreases blood sugar levels as well. So it actually works through the brain and promotes the endorphins of serotonin and dopamine, and helps your body to relax, which helps the body to heal itself as well. So we use the acupuncture in combination with treating the medical points to actually help, again, release the stress and promote that smooth flow of energy and blood within the body. And acupuncture is renowned for pain relief as well. So it works really, really well for pelvic pain and lower back pain. And we'll be putting needles in to help with those conditions, as well as preparing her for labour as well. So pre-birth acupuncture is actually really, really beneficial because we provide a safe environment for the woman to come in. She feels nurtured. She actually gets a chance to rest. She feels empowered because she's actually doing something to help her to prepare for birth and labour. She's getting herself into the best possible condition that she can be. It enhances her well-being. We can help to ease the frustration, tension, anxiety, or fear that she may be experiencing. We provide a good space to just listen to what she's going through. She might not necessarily be able to talk to others about what's going on. So helping to provide that listening ear also helps to calm women down, and just get their emotions out, which is really, really important. And all of this just, again, helps to promote that harmony within the body, which helps to promote a smooth and efficient labour. So breech and posterior babies. So the best time to treat a breech position baby is actually 34 to 35 weeks. So, and we will do this with moxibustion as well. So the woman will come in for her initial consultation, and we'll actually go through the initial consultation, and then we'll do the moxa bilaterally on the malposition baby point, so the little toe point. So moxa is actually a herb. It's actually really warming, and what we do is we hold the moxa over the little toe point for 20 minutes, and this actually goes up into the pelvis and stimulates the body and gives the signal to the baby to actually turn from that breech position to try and turn it into the anterior position. So once we've finished the moxa, we'll send the client home with moxa and instructions on how to do the moxa. They need to do the moxa consecutively for 10 days as well, because we have found that we will moxa for 4 to 5 days, baby will turn, they'll stop the moxa, but baby will turn back to a breech position again. So that's why we say 10 days consecutively. So most babies will turn. I find from clinical experience about 70% of babies will turn, Those that don't turn are in the best position for them, and there is a reason that they're not turning. So from my clients, we've had one that actually had its feet stuck in hernia mesh, and another one actually had one leg up here and one leg down here, so it literally couldn't turn, and they needed to have a C-section. But again, we prepared them for that C-section prior to going in. So women, if they haven't turned within 10 days, we'll give them a break of 5 days and we can try again. And generally I'll start talking to them about their options, like it is looking like we're going to a C-section. So let's start just preparing you to go through a C-section. It doesn't mean that we stop trying. I will keep trying as long as the woman wants to, but we do start bringing up, you may need to look at the emotional state of how you're in, and it looks like we're going to a C-section, so let's start preparing you for a C-section. But we're always going to be talking her through what she's going through as well. So posterior babies, so we're going to use that little toe point, bladder 67. So you can use acupressure and acupuncture. So this point's again on the end of the outside of the little toe. There is a point combination which we can use with acupressure, and which I actually teach to all of my clients coming in, and I'll get them to do this combination once a day while baby's still posterior. And if baby's posterior going into labor, I get them to do this point combination at the start when they go into active labor, and then to get baby to try and turn into an anterior position. And we know that baby will have turned from a posterior to an anterior position, because there'll be a great reduction in the amount of lower back pain that she's having, and in the way the contractions are happening as well, from going from that lower back all the way up to the shoulders. So you can use this throughout your pregnancy, during the birth preparation, and also when you go into labor. So my last client, we had a posterior baby. I treated her from 36 weeks. I was acupuncturing this point every time and getting her to do the acupressure combination. She went into labor, she did this combination, baby turned, and she ended up having a 2-hour labor. So just going to show that it does work. So when you're doing the acupressure for this point combination, my partner referred to it as the meat hooks. So on either side of the ankle, you're going to get your hands in this position. You're going to come in through where the calcaneal tendon is, so the back of the heel, and then you're going to press in and hold it for 2 minutes. So this is called bladder 60, and we're actually activating the inside meridian of kidney 3 as well. We're then going to use bladder 67, which is the little toe point, and spleen 6 to ripen the cervix as well. So this enhances the optimal fetal position and getting baby into an anterior position. So as well as doing this combination with acupressure, I'll reinforce the optimal fetal positioning. So getting her to do homework in between our sessions. So being on all fours, scrubbing the floors, being on all fours and doing figure eights. She can also do curb walking, so walking with 1 foot on the curb and 1 foot on the road, just so that creates some space and baby can turn in that position, using that as well. So acupressure in labor. So acupressure in labor is actually a form of natural pain relief. You can use it during the early form of labor. I used it for both of my girls. And I actually teach this to all of my clients as well. I get them to come in, we do a one-on-one session, so that in between the appointments, they can be doing acupressure to themselves. So we're reinforcing that birth preparation, and then going into labor, they know where all the points are, they know how hard to press, they've trialed it all, they've already done all of the birth preparation, and then they can just use it for pain relief in labor. So it's actually really good, because for those people that are really sensitive to medications, this actually forms a really safe and effective and form of non-drug relief as well. So using acupressure in labor actually increases the strength of the contractions, which is why using acupressure can actually decrease the time in active labor. And if you've been doing your acupuncture and your acupressure, you can actually reduce the amount of time you're in labor well down under that 6 hours as well. So again, acupressure is really, really important, and midwives can actually use this while the woman's in labour. So I've actually taught quite a few midwives the different points, and they use it in labour, and they actually report that the women have a higher satisfaction and a lot of pain relief from using these points, and that they're really amazed that the strength of the contractions really goes up on the monitor, and they say that they can actually see it happening. So by increasing the strength of the contractions, we actually reduce the time that a woman is contracting for as well, which helps to reduce the amount of time that they're in active labour for. So I've actually included with the link that you'll get. So Deborah Betts has actually written this booklet, and she has been promoting acupressure for natural pain relief in New Zealand since 1997, and has taught numerous midwives how to do this. And she also has booklets for if you're preparing for a medical induction, or for the baby's posterior, or you've got an anterior cervical link. So the cervical lips, these links are all provided for you in the follow-up. I can't reiterate using acupressure in labour enough. It's an amazing tool, and I don't think it's utilised by enough people. And the fact that women can go home and use acupressure on themselves as well in between having acupuncture appointments, it just reinforces and re-empowers them that they're preparing themselves, and mentally and physically, it just builds them up so much. And I notice a difference between those of my clients that we actually do the acupuncture and acupressure with, compared to clients that come in postnatally that haven't had any of this done. So I'd just like to conclude now. So based on the recent research, using acupuncture for birth preparation helps women to have a decreased active labour time, around approximately 6 hours. There's the decreased amount of intervention as well. So we have less forceps births, less episiotomies, less C-sections, less need for medical inductions, and they also have a much better recovery as well. So from all the research that's been done, and from reports back from midwives and doulas and other birth professionals, is that they would really want to see all women have access to having acupuncture to prepare themselves for birth and labour, because it's just such an amazing tool, and they notice such a difference in the women that do have this, from recovery to just the emotional state and physical overall well-being of themselves and their baby. So I hope you've enjoyed my talk today, and I look forward to answering your questions.
Wow, Julia, that was absolutely fantastic. I would say, hand on heart, I think that's one of the best presentations we've had all year, and we've had some amazing ones, but boy, you're really up there. And thank you for all the huge amount of years of preparation that you've put into this presentation today. It's absolutely fantastic. I imagine we're all sitting there going, yes, and you can hear people clapping. So thank you, thank you. It was a very excellent explanation. And yeah, so look, if anybody does have any particular questions, please do type them into the Q&A. But certainly I know that probably whatever questions you may have had, Julie has probably covered them off through this. So those that are here watching live, and those that registered to attend this particular webinar, will receive an email tomorrow, which will provide links and further information. But for those who are watching it after the event, sort of, so we're just leaving up this screen. Oh, can you go back to the previous slide, 17? Yeah. Yeah, there we go. So that acupressure booklet link at the bottom there, if anybody who's watching it after the event can just sort of handwrite that down. We'll leave that up for a little bit longer. So yeah, that acupressure document put out by Deborah Betts is just, I mean, it's, you know, she is the guru on this, and it's amazing. If you've never watched a couple in labour where they are working almost like as a team, using acupressure. It is absolutely amazing to watch. And this is where, you know, the birth support person is helping the mum, and he or she, the support person, already knows the points. They've, you know, rehearsed these things, and amazing to watch. And it acupuncture definitely reduces lengths of labour, for sure. I mean, we know it within the research, but, you know, it makes a huge difference. Do you want to talk a little bit more about the cervical ripening aspect? So if you've got, Julia, someone who, say, is very limited with their funds, to be able to invest in acupuncture, what do you think would be the most important, you know, times that they see somebody?
So in terms of they've got limited resources, or in terms of...
So if they've got limited funds and they can't really come for, you know, the optimum amount of appointments, when is the most critical time, do you think, for them to see an acupuncturist?
So I would definitely say, look, if they've got limited resources and they really need to come in, I would actually get them in at 36 weeks, and I would do the acupuncture on them, show them the acupressure points, because then they can go home and do it all themselves. And generally, I will actually follow them up and say, how are you going? Do you have any questions? Do you need any help? Because if they've got limited resources, it's really important that they come in so that I can actually show them how to do the acupressure. And even then, if they can't come in, I'll refer them to Deb's website. They've got the app there, and she's actually done videos now.
There's an app on Deborah's website as well.
Yeah, and she's actually done videos now as to how to press the points. So if they are having problems, I'll refer them back to Deb's website as well. And I've seen a couple who did have limited resources. I taught them everything. They did all of the acupressure and everything prior to going into labour. And she'd had a previous really bad labour where she had 3rd-degree tears. And there was a lot of fear, a lot of anxiety that would happen again. She actually went into labour, had a 4-hour labour, really smooth, really efficient, no tears whatsoever, because everything was already done. And she said it was just such a difference from her first labour, and that she wished again that she'd known about it with her first labour.
Yeah. Oh, that's right. So often true in that second time round situation where, you know, women, perhaps you do see it with primates where they don't necessarily fully engage in as much as they can, and sometimes with their education, a lot of priorities with what's happening at work, and getting stuff done, and painting the nursery, and choosing the right card, and you know, you're like, well, I really want you to, you know, watch this video, or I've just been a bit too busy. And then that second time round, it's like that's so, I am not going through that again. I want to learn about more stuff this time. But the address that's up on the screen there, the Acupuncture Rhizome Net NZ, that's basically Deborah's main sort of website, and so that's where people can have a look around, and then the rest of that URL of the DVD information is just that particular one you're talking about. Yeah, so look, it's just been absolutely fabulous, just such good information. Is there anything else that you would, really the questions that have come in have been answered, so we could tick those off, but is there anything else that you'd like to add before we close today?
I guess that as well as using acupuncture prior to birth preparation, it's really important in postnatal care as well. And there's so much that we can do postnatally. So especially women with C-sections, we can actually do scar tissue repair. So many women who actually report that they've had a C-section feel like they're not actually in their body, or they're not themselves anymore. And what happens with the C-section is they actually cut through many of the actual meridians. So the meridians aren't actually whole. So part of our treatment that we do with C-sections is actually repairing the cut, and repairing and reconnecting the meridians. And a lot of women, including myself, who've had a C-section, we actually notice the difference when that is done, and we actually feel like our cells are coming together again. So acupuncture plays a huge role in preparing women, but also looking after them postnatally as well. And I do that with the birth preparation. So I start talking to them about preparing meals and eating congees and what the best food is to eat postnatally, so that we can reinforce, the production of breast milk. But we can also treat issues with breast milk production, mastitis. So, we tend to go hand in hand. So we don't just, go, oh, let's have your baby and we'll see you later. It's really, really important that we get that treatment going postnatally as well, because we can actually change a woman's health postnatally with how we treat them.
And I find that very interesting, your comment that that the C-section literally cuts through some of those meridian lines. And because I think a lot of us have heard of meridian lines, and we understand that they're flows of energy. But when you visualize, you go, oh wow, yeah, it has. It's literally cut through them, and so creating that healing. So in an optimum situation where kind of money's not an issue, if somebody has had a C-section, what would be the optimum that you would want, that you feel that they should be, when should they go and have acupuncture? How often? What would be the optimum in that postnatal period post C-section?
So that's really hard to answer, because it actually depends on the female herself and what's happened with the birth. And what emotions she might have afterwards and what's going on with bonding and breastfeeding. I will generally do a home visit postnatally to make sure that they see me after a treatment, and it's really hard for women to get out in those first six weeks.
Yes, and at what sort of stage would you usually do that first home visit?
So I'll try and see them within the first week of them actually having the baby, just to reinforce the energy flow, the blood buildup as well, and just calm any emotions that she's having, because we all know that period is especially with all the emotions going on after giving birth and the third day blues. There's a lot going on, so we just reinforce calming and bringing her back into harmony. And providing that reassurance that everything's okay, that she's doing the best that she's doing. And then generally I'll say from 6 weeks, we'll get you in and we'll start the C-section healing treatment from there. Right. And some women, they may only need 4 or 5 or 6 treatments. So it's until we can get that feeling coming back. So we'll actually touch the piece of skin that's outside of the scar line and then touch the scar line. And once they're actually feeling the same, we know that everything's reconnected and that they're whole again.
Wow, that's so interesting, because, certainly women, particularly if they've had more than one Caesar, will often make the comment, like later in life, that there's still none there.
Yeah.
Yeah. And so, wow, so that's their meridians never really healed properly.
Yeah.
Fascinating. Okay. Well, look, we will wind it up there, and it's just been such a pleasure having you on board, and thank you so much for the very obvious massive amounts of preparation that you put into this presentation, and it's very, very appreciated. So thank you so much, and we will end this very last webinar for 2020. What a crazy year it's been for the whole planet. And here's to 2021, everybody. Have a wonderful Christmas period. Bye.
Bye.